Okay, so next we're going to go over the setup for an ultrasound, and then following that we'll work on phonophoresis. So of course with any modality, as we've said over and over and over again, you always want to think about the indications, contraindications, and precautions. Safety is always your number one thought process. So again, I'm going to ask this individual, do you have any active cancer anywhere in your abdomen, low back?
No, I do not.
Okay, and do you have any metal in your body? No insulin pumps, anything like that? Very good. And no fractures? You haven't been diagnosed with any kinds of fractures or anything there? Okay. So running through your list of contraindications, and we're going to go over those. Those are certainly things that you should know for your lab practicals, are really important, and it's always important to ask the patient, even ask them multiple times. Next, we always ask the patient, how are you going to be most comfortable? So in this case, with a low back, they were most comfortable with kind of a pillow underneath their abdomen. A lot of times lying in an extended position for low back pain is not a real comfortable position. So next is keeping the patient draped and covered as much as possible. So in this case, I'm going to cover up his shorts and just kind of tuck my towel just a little bit under his shorts to make sure I don't get any ultrasound gel on his shorts. So just kind of tuck everything in his shirt that I can come up with. So if we're focusing on maybe he's got a muscle sprain or strain over here on this left side, this paraspinal, then we are dealing with a very muscular, thick area, so we certainly have enough tissue that we can apply a little bit deeper penetration. So in that case, and we'll go over the settings for ultrasound, but I'm going to go with a 1 megahertz setting. And when this setting, if I want thermal effect, I'm going to stay at continuous, or what would be considered 100%. So I've set my parameters where I want them. So the next thing then, of course, time is ranges depending on what you know, the tissue and the settings that you have. We'll discuss that a little bit more in lecture as well. And I'm going to go my intensity up a little bit higher there. This again is a young individual, good skin integrity, good sensation, good flow. So I got no concerns as far as that goes. So next I'm going to apply a little bit of the ultrasound gel, and I usually warn them this is a little cool, right? So, and I usually just apply it in just kind of a dollop like that. So when we're looking at ultrasound, and we'll talk more about the principles of ultrasound when we in lecture, but I usually will look at the size of the sound head and double that. So the area that I want to try and cover shouldn't be much more than double the size of the sound head. Okay? So, and again, I have not turned my machine on. Turning the machine on with the sound head open to air will ultimately destroy the crystals in the head of the ultrasound and ruin the unit, or at least ruin the sound head. So next, I usually start here, just make contact with my ultrasound gel. The other mistake that I see a lot of clinicians using or doing is this is not a massage tool. So the idea is not to push it into the skin and try and push the gel or spread the gel out. Really, the gel is the medium for the sound head to, for the sound waves to be transmitted through the skin. So really all you need to do is just lightly apply the sound head. And I like to go in circular patterns that overlap each other. Some people like to go back and forth in a grid-like pattern. That certainly can be your own preference. So the key is that you keep moving. So again, I'm going to start my unit, and you'll see the green light come on the sound head, which means that we're active and live. Sound waves are now being transmitted, and we can slowly then start making our circles in an area that is roughly double the size of the sound head. The next thing that I would be doing is constantly keeping in contact with my patient and letting them know, is that comfortable to you? Mm-hmm. Ideally, the patient should feel very little, if anything, other than you just lightly rubbing. Occasionally, they will feel a little bit of warmth. It should never be prickly or painful or uncomfortable. If it is, then you need to stop and reassess the situation.